Okay, now I'm going to perform MMT, manual muscle tension, and see what grade I can give my patient. So first we're going to do hip flexion. So if you go ahead and raise your knee up, good. And I forgot to tell you to put your arms across your chest and raise your knee up. Okay, good. You can put it back down. And now you're going to raise it up, and I'm going to stabilize here and raise it up a little bit. Okay, and hold, 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 hold. Okay, good. So at first she was able to do it against gravity and with no resistance, so that's a 3 out of 5. Then when I applied maximal resistance, she was able to do 5 out of 5. Okay, so now I'm going to test hip extension MMT. So I have the patient lying prone on the table. And so first, lift your leg up straight, keep your knee straight, and lift it up as high as you can. Okay. And you can see a little bit of hip rotation, so I'll have to make sure I put my hand here, keep it down. Okay, lift it up again. Okay. And you have to keep it up, and I'm going to push down, and if you can't, and try to resist, okay? So resist, resist, resist. Okay, good job. So she was able to resist full maximal resistance, so I give her a 5 out of 5. Now we're going to test the hip abduction. So I'm going to have you just lift your leg up as high as you can. Okay, good, good. Okay, you can put it back down. Okay, now I'm going to stabilize right here in the hip, around the iliac crest. And as she lifts her leg up, I'm going to push down and ask her to hold. So when you're ready, put it up and hold, hold, hold. Okay, good. So she was able to resist maximal resistance, which gives her a 5 out of 5. Okay, now we're going to do the adduction. So I'm going to have you bend your leg and put it up here. Try to keep this one straight. And you're going to lift this one up. So you're going to lift the bottom one up. There you go. Perfect. Okay, put it back down. So again, I'm going to stabilize in the hip. And you're going to lift it up. And I'm going to push down. You're going to hold. So hold, hold, hold. Okay, good. So with the adductors, she was able to hold as well. With my maximal resistance, giving her a 5 out of 5. Okay, now I'm going to test the internal and external rotation using the MMT. So first, we're going to do the internal rotation. So just bring your foot out to the side as much as you can. Keep your foot neutral. Okay, good. All right, now I'm going to add stability on top of the knee. And I'm going to add pressure just above the lateral malleolus. So put it out, not all the way, but some. Okay, and I'm going to push and you're going to hold. So hold, hold, hold. Okay, very good. So she was able to resist maximal resistance on the internal rotation. So she gets a 5 out of 5 for that. Now we'll do external rotation. So push your foot back this way and put the foot this way. Okay, good. All right, so I'm going to do the same thing and put my hand up here and exert maximum pressure on the medial side and superior to her medial malleolus. Okay, stick your foot out a little bit and hold, 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 hold. Okay, good. So she again was able to get a 5 out of 5, resisting my maximal resistance.